Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Actually, we just changed our name this year to Integrative Movement Institute. Thank you so much for being part of our community, and thank you for what you do for your clients, because as you know, some crazy stuff going on in our country and our world, and now we need leaders just like you to bring people together, not create more divisiveness. Because remember, your clients are struggling. They have stress, they have issues, they have chronic tension, maybe pain. So they're looking to you not only for solutions for their health issues, but also as a voice of reason, so to speak, to bring people together and to provide that solid and consistent, message to them of hope, of faith, of community. So thank you for what you do. Thank you for being there for your community and allowing us to be part of your community as well. And as we mentioned, a lot of people have neck tension and stress because, again, many people have been many people, all of us almost in this country have been in quarantine for the last 9 months. Here we are going on 10 months now. There's a lot of stress and uncertainty in the world, so that brings a lot of neck tension. So in this brand new series, Two Anatomy Geeks, you've heard of us talk about the Two Anatomy Geeks. As I'm wearing my Two Anatomy Geeks shirt here, my fellow anatomy geek, Jill Leary, who's a anatomy instructor at the massage school where she was a student of mine 20-something years ago, and now she's been teaching for the last few years there, functional anatomy. We're bringing this brand new series to you to help you with clients that have chronic neck tension and a lot of that forward head posture, because that is a big cause of, or a major cause of, neck tension and even discomfort, and even why some of your clients feel weak in their arm or create arm and shoulder and or arm issues. So I just want to share a couple things with you and actually invite you to a free webinar that we're doing this Thursday evening. No charge. Mary will put the link next to this video once I'm done here. Now, if you train the older clients, and you like to do this while you're part of our community, Robert Linkle and I, we just did a 2-day workshop on the Arthritis Training Solution 2.0. And one of the major strategies around the shoulder as well as upper issues, the head, neck, upper thorax, is what you do with your clients and also what they're doing with their shoulders. Many of these things they've been taught to do by well-meaning parents or coaches or trainers or physical therapists or chiropractors. And that one thing is, and it's a common reason and a common overlooked reason why so many of your clients have that forward head posture is actually shoulder, not elevation, but shoulder depression. This is a very common reason for shoulder issues, but we'll focus on the neck right now. Because when you depress your shoulders too much, you put stress on the nerves coming out of your neck. The body does not, the nervous system does not like stress on the nerves or chronic tension. So think about your nerves like a rubber band. They don't like to have chronic tension. So what will you do if you have chronic tension on your neck, or even chronic compression? It will do what? It will start to raise your shoulders up. Now we know that people will have elevated shoulders because of stress. That's a very common stress reason, and which is one of the most common reasons for neck tension. But when you overstretch your nerves, just like when you overstretch this rubber band, what's the neck or the nervous system going to do? It's going to keep trying to bring your shoulders back up. And then we teach our clients, bring your shoulders back down, squeeze them down and back, brace them down, pack them down. And then the nervous system's like, I don't like that feeling, so it'll pull them back up. So you can even do this with me. So bring your shoulder blades, bring your chest up, because that's part of this as well. Bring your chest up and squeeze your shoulder blades down and back. And now hold that, and now try to side bend your head. And side bend your head the other way. And it's like, it doesn't go, and it feels awful. I was actually shooting a couple videos yesterday that I actually just posted on Instagram. So if you want to check it out, it's on Instagram. Our Instagram account is IIHFE. And when I was done shooting the incorrect way, this way right here, I was doing shrugs, I had numbness in both arms. Because what you will also do when you over-retract and depress your scapula is you will close off these spaces where those nerves, that brachial plexus and nerves coming out of your neck, they will come through your neck muscles, underneath your clavicle, and then underneath your pec minor to go down your arm. But the more you depress your shoulders and really pack them down, like you and I have been taught from day one almost of training 101 teaches you, yeah, chest up, squeeze down and back, that proud chest, that big chest, put the shoulder blades down and back. You can even see what it does to my shoulders. You see this big slope of my shoulders versus like when my shoulders are in the more optimal position. Here, no neck tension. And again, like I said, just do it with me. Bring your shoulders back up where they belong. Check your side bending of your head. Now chest up, squeeze down and back. Now check side bending. It doesn't feel good. It doesn't feel better. It doesn't create relief. Now take your rubber band. If you have a resistance band, grab it. And if you don't have it, just watch me and do this later. Now put some tension in that rubber band. So now just imagine now you're carrying a bag of groceries, or your client's carrying a bag of groceries, or doing exercise in the gym like carries. We love carry patterns. But what happens is they're taught to up, bring your chest up, squeeze shoulder blades down and back, and now you have a weight pulling down. And now, when you do this later on, same thing. Feel what it feels like in your shoulder, in your upper back, but then try to side bend your neck. It's like, it doesn't go. That's not where the shoulder belongs. So the shoulder position, and actually shoulder depression and over compression of the shoulder, is a common overlooked reason for chronic neck issues. And there's rarely a client that comes into our office. I just had a client, Robert. He came in and he had chronic neck issues to the point where when he turns his head, he's like, I can't turn my head without a crack, 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 and it's painful, and he can barely move his neck. So what are we doing then? I'm going to give you one of the biggest, most important keys to solving neck issues, is to get your clients to create space in between their ribs, because if you look at a lot of your older clients, what posture are they in? Shoulders are down. They could be forward, but they're compressed down into their body. Their ribs are compressed, especially underneath their shoulders, because the lats, the pecs, all these big muscles can pull the shoulder blades down tight, and that's ultimately what compresses his client down and brings their head forward. So what we need to do is create space underneath the armpits, and we give our clients a visualization to open up your ribs and visualize like your ribs are almost like an accordion. You need to create space underneath your ribs, and now send your breath. We'll oftentimes put a strap, not this, but like a yoga strap, I'll just use this, around the rib cage like this, and then around the back like this, and now they'll send their breath into that strap. And I want you to do this. You can do this with me now, or do this later after you've done this little experiment with a rubber band. And then you breathe, and I cue them to breathe out this direction, not up and not belly, but out this direction, like into the cylinder. If you think of your rib cage like a cylinder, because that's essentially what it is, the rib cage of the pelvis forms this thoracopelvic cylinder that you've heard us talk about. If you turn it from here to turn it like this, it's a cylinder. You want to think of breathing into that cylinder this way. So expand that cylinder all the way around, which is why that strap works so well, and then go back and check your range of motion. Even after do 5 breaths, check your range of motion before and after, and almost 100% of the time, if you've done this well, and the last thing I should say, cue length through the back of the head and neck. Not chest up, not chin retraction, but length as if you're being pulled up from the backside of the head and neck. And almost 90% of the time, you're going to find changes in range of motion of the neck rotation, and also side bending. Maybe not fixed, maybe not 100% correct, maybe their pain isn't 100% gone, but they will feel a difference if you've cued them well and they followed your instructions as you've taught them. Super powerful, super common issue. The shoulder depression, shoulder compression, depression and or compression often go hand in hand. And it's an easy way to help your clients manage chronic neck tension throughout the day and actually relieve common issues. Just like Robert, I had him cue, he'd been through physical therapy, it wasn't working. I just had him cue, create space, and then he was able to rotate his neck with almost no cracking and much improved range of motion. Now, how long does that last? As long as he goes home and works on it. And he's been better at, because in the beginning they're like, yeah, breathing, how does that work on my chronic neck tension? But again, it's 100% part of neck issues, because when you're not using your diaphragm, you're not breathing through the cylinder, all the way around the cylinder, you will overuse all your neck muscles, which are accessory muscles of respiration. So, we want to invite you real quick before we get off to a free webinar we're doing this Thursday at 6 p.m. Central. Mary will put the link in this video once I'm done with it. It's a free 30 to 45 minutes. It's usually 45 minutes, more than 30 minutes, because Jill and I get going a little bit. We're going to teach you about the upper trap and levator scapula, simple, easy things to both learn and understand, discover about the functional anatomy, so that way you can determine how to assess and use the best corrective exercises, and we'll show you how to use the principles of the integrative movement system, alignment, breathing, and control to help your clients. So if you like this, jump on the free webinar. You have to sign up. We only have 100 spots, so it will fill up. Like last time we did this, we had over 200 people sign up for this free webinar. So jump on, and if you can't be on live, then we will send you sign up anyway. We'll send you the recording once it's done. So this is Dr. Osar. We'd love to see you on the free webinar, and then we'll invite you to the next series of 2 Anatomy Geeks. It's a 3-part series covering the head and neck, where we cover common reasons why, more common reasons why your clients have chronic neck issues, and more importantly, not only do we want you to understand functional anatomy so that you truly understand how the body works, but more importantly, we want you to be able to apply this information. So we never teach you anything and say, hey, go figure out what to do with it. We teach you the information and show you some of the best strategies, the strategies we use with ourselves and our clients and our patients in our office. So we'd love to see you. Thank you again for all you do. Keep the faith, keep empowering your community, and we'll get through this stronger and a more united community. Thanks so much. Have a great day.